Yeah. So I think, the best combination, as Sir has already mentioned, double test, doing an RT-PCR twice may not mean as much as doing an RT-PCR along with a serology. And if you can space it out, better it is, I think. So if you can do RT-PCR on day one and antibody on day 5, it gives you much more information.
Dr. I'm glad you didn't ask me and Jagdish, because even if we want to do, we are not allowed to do.
They are not allowed.
I understand that, yes.
We hail from such a place, but the High Court has intervened. So,
in fact, that's a very sorry situation, because hats off to you, all of you who are actually committed to your job so much. You have not been refusing a single patient despite those limitations.
Not really, Rajesh. See, we are not spoiled by choices. We don't have any choice, so we are just going one way.
And there was another question.
Bhojwani, Rudra, what I will do is, for the academic completion, for all the students who are locked down, it's very important to know RT-PCR is sensitive only during first 1 week, and it has got 26 to 30%. So if you do RT-PCR, it should be immediately within like 72 hours on the day of surgery. And an antibody spot test is not sensitive good in first week, but second, third week it scores over RT-PCR antibody testing. So if you are in an ideal situation, RT-PCR within 72 hours to 48 hours before surgery, HRCT a day before, antibody testing at 1 and then 7th. This would get you at 95 to 97% safety, but it is not possible. But it's an ideal situation, so you need to balance all of that.
No, I would say, I suggest that the ideal situation is what Telangana government has done. That is, no, I'm not joking. Seriously, you had no choice, because you take precautions as though they are positive and they are treating everybody. No fatality either for the patient or for the affected people. So I feel Telangana has done a good job.
It's very important to know that surgery is done under full PPE. The whole surgical team still become positive, because there is nothing called level 1, level 2, level 3 PPE. Either no protection or a hazmat suit. All of us cover body well. Head and neck is not covered. We are in false security. That's why we all become positive. So many surgeries done in India on positive patient. Whole team has turned positive in spite of full PPE. Either a hazmat suit or no. There is nothing in between.
That's all.
Actually,
Rajesh, so there is, for you, everything is, whatever we are doing is suboptimal PPE.
Correct.
Yes.
The answer for your slide is everything that we do is suboptimal.
You see, there is no evidence that what we are doing at the moment
is optimal.
There's no evidence about it. And there's no evidence that hazmat suit protects you 100%. There's no evidence of it. The problem, as I believe, and that's my personal opinion, the problem was that in many places, say about 1 month back, we were getting very suboptimal quality PPE, and that was giving a false sense of protection. These were the PPEs which had the holes. These were the PPEs which were prepared from a cloth which had low GSM. And therefore, I've been talking to a specialist, and I think it's a good tip for everyone. If you are doubtful about the gown that you are wearing, a very simple test that you can do without knowing what's the GSM. The ideal GSM should be more than 70 or 80. But a good test is you take that cloth, open one gown, and you put water or some liquid on that gown outside the table, okay, and watch it for 15 minutes. If the gown does not let any drop of water come through it for 15 minutes on the upper surface, you have a good PPE in your hand. Okay, so that 15-minute test gives you all
the main problem in PPE is very well protecting the body, very suboptimal head and neck protection. None of the PPE kits other than helmet comes with the N95 mask, covering only hood they give. So what happens is we take a beautiful PPE, suboptimal head and neck cover. Even a good N95, you should not be able to smell agarbatti. But I'll tell you, you just wear a N95 and put agarbatti around that, you will come to know. And we can't breathe more than 32 minutes.
No, Rajesh told a test for PPE. Som is telling agarbatti test for N95.
So with that, I think we will close today's webinar. and I'm really delighted to have all the eminent faculty from surgical oncology, Professor Vijay, Kumar, Rajesh, Bhojwani, and then Dr. Somashekhar, then Dr. Sandeep, Dr. Saklani, Jagdish Gaud, Devender, Subhu sir, and Jagannath Dikhet for a very vibrant panel discussion on a serious topic which is very close to our hearts. Since last, I think we were on WhatsApp since last 2 months, and everybody tried to be committed on the panel discussion and the talks on the state topic. So I'm very thankful to all for bringing out beautiful discussion. Thank you very much.
Rudra, before that, big 3 cheers to you. It was your initiative, persistent. You went after all of us, made sure we came. So big thank you to you and my team, Rajesh Sharma and their whole team who has been excellently coordinating with us. We should thank Kalpesh and Rajesh and their team and you. We just came because of our...
We had 400 plus registrations, which is a very good number for the...
Awesome.
And we will be bringing up the next episode of AMASO webinar very soon on a different topic. Thank you very much.
Great job, Rudra. Thank you very much.
Be safe. Take care of yourselves.
Be safe. Thank you very much.
Bye-bye.
Thanks all of you.